हेलो डॉक्टर्स। तो जैसा कल मैंने नीट पीजी पे अपने कुछ पॉइंट्स जो मैंने लास्ट ईयर ज़िंदगी में पहली बार नीट पीजी एग्ज़ाम दे के जो कुछ मैंने महसूस किया वो आपके साथ शेयर किया था, और आप सब ने उसका इतना अच्छा रिस्पांस दिया कि मुझे लगा कि मैं और किस तरह से आपकी मैं हेल्प कर सकता हूँ। तो आज इस वीडियो में मैं डायबिटीज़ से रिलेटेड 5 MCQs जो इस वीडियो के एंड में दिए हैं, और शुरू में 11 मेन पॉइंट्स जो डायबिटीज़ के लगभग सभी इम्पोर्टेंट वन लाइनर्स क्वेश्चंस को कवर करते हैं वो दे रहा हूँ। तो सभी वो स्टूडेंट्स जो नीट पीजी में क्वालिफाई करना चाहते हैं और डायबिटीज़ मेलाइटिस उन्हें बहुत टफ लगती है, इतनी ज़रूर कर जाएं। आप देखेंगे कि एक दो क्वेश्चन इसमें से आपको ज़रूर मिलेंगे। ऑल द बेस्ट, और आइए शुरू करते हैं आज का वीडियो। यूज्ड इन डायबिटीज mellitus which are given as injectables are insulins, GLP-1 agonist, pramlintide and semaglutide. And semaglutide is used both as oral as well as injectables. Point number 2, inhaled insulin is available as Afrezza and it is used with inhaler device so that it can reach to lungs for its effect. Point number 3, which insulin is used as IV preparation? Regular insulin. And point number 4, longest acting insulin, it is also regular insulin which has half-life of 42 hours. Point number 5, drug used for diabetes mellitus which can cause hypoglycemia. It is insulin and sulfonylurea, and both can cause weight gain as well. Pioglitazone also causes weight gain due to sodium and water retention. Point number 7, weight neutral antidiabetics are metformin and DPP-4 inhibitors. Point number 8, weight loss is caused by SGLT2 inhibitors, GLP-1 agonists and pramlintide. Point number 9, pioglitazone causes sodium and water retention, so don't use them in CHF. In females, there is increased risk of fracture due to osteoporosis. And one more thing, dapagliflozin also causes increased risk of fracture, but that is gender neutral. As you can see here, dapagliflozin causes UTI and mycotic infection, and rare side effects are foreigners gangrene, ketoacidosis and increased risk of fracture due to risk of osteoporosis, but it is gender neutral. And point number 11, semaglutide used by celebrities to lose weight. Hope these 11 points will serve the purpose and you will find one or two questions from these 11 points. And now let us discuss 5 very important MCQs. And most importantly, they are the very latest questions. You won't find them anywhere. Which medication have a high durability of glycemic response, most likely through a potent effect on preserving beta cell function? My choices are thiazolidinediones, metformin, DPP-4 inhibitors and sulfonylureas. And the correct answer is A. Thiazolidinediones are oral medications that increase insulin sensitivity and are of high glucose lowering efficacy. TSDs have a high durability of glycemic response, most likely through a potent effect on preserving beta cell function. References दिए, कोई डाउट नहीं है एकदम. Question number 2, which considerations should be considered for the management of type 2 diabetes in people with non-alcoholic steatohepatitis? A. Consider SGLT2 inhibitors therapy or thiazolidinediones therapy to reduce NASH activity. B. Avoid bariatric surgery whereas possible. C. Lifestyle modification with a goal of weight loss. D. None of the above. And the correct answer is C. The management of type 2 diabetes in people with NASH should include lifestyle modification with a goal of weight loss, including strong consideration of medical and or surgical approaches to weight loss in those at higher risk of hepatic fibrosis. Question number 3. What evidence outcomes has offered intensive BP control less than 122, less than 140 millimeter Hg according to Sidu et al. Systemic review and meta-analysis of randomized controlled trials? A. It has not shown benefit for older patients with diabetes mellitus without evidence of harm. It reduces the risk of adverse cardiovascular outcomes in older hypertensive patients in the general population with no increase in adverse events. C. It reduces the risk of adverse cardiovascular outcomes. D. None of the above. And the correct answer is aggregate trials evidence shows that intensive BP control reduces the risk of adverse cardiovascular outcomes in older hypertensive patients in the general population with no increase in adverse events. Intensive BP control may confer similar benefits for older patients with diabetes mellitus with no evidence for harm, but this is based on limited data. Question number 4. What medication has been associated with a lower risk of dementia in patients with diabetes mellitus, particularly those with a history of stroke or ischemic heart diseases? And choices are triazepatide, pentoxifylline, pioglitazone, dapagliflozin. And the correct answer is pioglitazone use is associated with a lower risk of dementia in patients with diabetes mellitus, particularly in those with a history of stroke or ischemic heart diseases, suggesting the possibility of applying a personalized approach when choosing a pioglitazone to suppress dementia in patients with diabetes mellitus. Question number 5. Based on the study by Vander Heide et al. On alcoholic consumption and microvascular dysfunction, what type of intervention could prevent microvascular dysfunction? Bariatric surgery. Second, subcutaneous semaglutide followed by other GLP-1, SGLT2 inhibitors. C. Physical exercise. And D. Dietary interventions. And the correct answer is the present cross-sectional population-based study found evidence that alcohol consumption may have an effect on microvascular diseases. Hence, although increasing alcohol consumption cannot be recommended as a policy, this study suggests that prevention of microvascular disease may be possible through dietary interventions. These 5 questions will serve the purpose even of those who are preparing for an INI-CET, because this is latest literature I got from a very reputed company and I have shared it on my channel. तो आज का वीडियो आपको कैसा लगा? मैं थोड़ी ऑडियो क्वालिटी को नेक्स्ट टाइम इम्प्रूव करूँगा और आप और भी जो सजेशंस आपको लगे, जिस टॉपिक पे आप चाहते हैं कि आपको वीडियो मिले, प्लीज़ उसको आप मैसेज के थ्रू मुझे सजेस्ट कीजिए. थैंक यू वेरी मच.